I'm going to do 3 videos today to determine whether or not you have any instability in your neck. The first and the third video, I'll attach a ruler to your neck because they're uniplanar movements, so we can measure and quantify how much excess movement is happening. And the second of the 3 videos is 3-dimensional, so there's no criteria for measuring distances or anything on that one, so we just end up comparing the levels to each other to see if one is different than the others. So the first movement that you're going to do is going to be with your mouth open like you just had it, and I'll make sure that your positioning forward and back is correct so we're seeing the first 2 bones in your neck. From there you're going to basically tilt your head to the side, first to the left then to the right, and we're going to repeat that 2 or 3 times with your mouth open, and I'll talk you through it. Alright, so go ahead and tilt your head to the left as far as you can. Perfect. To the right as far as you can. And back to the left as far as you can. Chin down just a touch. There you go. Go ahead and turn your head to the left. Down as far as you can. Good. And back as far as you can. Good. And down as far as you can. So go ahead and bend your head down as far as you can, a little bit faster yet. Good. And back as far as you can. Excellent. Do forward one more time. That's it, we're done. I'll save that one and then I'll show them to you. And so right now we're looking through your open mouth, and what we see are the top 2 bones. So these dark things here, those are your upper teeth and molars. And so with the mouth open, then we gain access to looking at these 2 bones. And so the top bone has this block on either side of this thin bridge, and then behind that is this cross-shaped bone, which is the second neck bone that has this tooth in it. And then so the first bone and the skull, they rotate around that peg on that second bone. In between the tooth-like structure and this block of bone, there's a light space and a light space. And so when we're evaluating the movement, as you do the movement in a second here, I'm assessing to see if these spaces remain equally spaced. They should stay relatively equally spaced. And the additional thing that I look at on either side when you go to the left and to the right is that this side margin here of that block on the first bone and the side margin underneath that of the second bone stay lined up vertically. As you go side to side, there should be no sliding of this margin to the side relative to the one below it, so no overhang. And then same thing the other way, so if there's overhang or if these spaces inappropriately change so that they're not relatively equal as you get to those side bends, then that indicates the likelihood that there's ligament damage that's supposed to be preventing those movements from happening but isn't, because the ligaments are either stretched or torn. Okay? So if I pause that, here's the side edge of your first bone, and there's the side edge of your second bone. So there's a portion of that first bone that is overhanging. This space has decreased, this space has increased. And we go to the other side. So if I pause that there, again, decrease space, increase space. Here's the side margin of the first bone, and there's the side margin of the second bone, so there's an overhang here as well. With this one, as you rotate your head out of the way. So you see these light-shaped ovals. So those ovals are formed by an archway of one bone and an archway of the bone below it that goes the other way. And so they form what looks like an opening, and through that opening is where the nerves exit. So one nerve will come out of this one, one out of this one, one out of this one, and it'll go to a particular part of your shoulder or arm or hand. And then so when you bend your head forward, those bones separate, and so this opening becomes larger. And then when you bend your head back, those openings approximate, or those arches approximate, and the opening becomes smaller. And so because this is a 3-dimensional movement, we're basically comparing the levels to each other. And just from like a standard neutral position right now, you can see the size of this opening, the size of this opening. They're both bigger than the size of this opening, and then it gets bigger again. It's a relative observation, but what's important is when you bend forward and bend back, how that opening and closing happens as it relates to the levels above and below. So if one excessively opens or excessively closes, depending on which way you've bent, that indicates also that the ligaments that hold that tightly packed have been compromised, rendering it too loose. So you can see how they all get bigger as you go forward. This is the right side of your neck, by the way. And then as you go back and close off, that one, and then this one indeed gets smaller, and then this one's bigger again, and that one's bigger again. So at this level, that opening closes more so than the other levels, which could pose the possibility that the nerve in there will get compressed a little bit in certain positions, but this does not look at the nerves. This just shows that there's a tendency that that could be happening. An MRI would then be able to tell whether that is indeed the case or not. Unfortunately, MRIs are rarely done with positions like that, so it's hard to stress that test to be able to confirm what I'm telling you right now from looking at the soft tissue like an MRI would, because they do everything usually in neutral. Then as you go forward, they all open up again. So the amount of change in the size of that opening at that level, and that's between between C4 and C5, the fourth and fifth neck bones, is more change overall from point A to point B than the other ones, which means that the ligaments have been stretched or torn that hold that tightly on the right side. So in a second we'll look at the left side and you can then compare. That's the benefit of doing this, is that sometimes people have arm symptoms on one side, and then this compared to the other side may show that there indeed is a difference, which would likely be a possible explanation as to why they would have those arm symptoms. So again, same explanation. So these ovals are light and roughly the same size here. So as you go forward, they all get bigger. And as you go back, they're all relatively the same size comparatively to the other one. And so a simple example of what we saw on the right would be, do you possibly have any numbness, tingling, or weakness in the thumb and index finger on your right hand on occasion? And if so, that may be the explanation as to why. In the back of your neck, this being the front of your throat, we're looking at this black line that delineates the back of that rectangular part of the bone, and to see if those black lines line up with each other. So as I go down, I would venture to say that this black line and this black line aren't continuous with each other, and same with this one and this one. And then when you get down here, they're definitely continuous with each other. But what's important is what happens when you bend your head forward and bend your head back, that if some are continuous and some aren't continuous, so some shift off center, one of those two has to be abnormal and one has to be normal or expected. And so based on the assessment of ligament integrity, if the ones that shift would be suspected to have been shifting because the ligaments that would not allow them to shift that far would have been stretched. And then the other spots that aren't shifting, the integrity of their ligaments is better. So as you go forward here, then this being your second neck bone, the black line there is not aligned with this black line anymore, and then these two are subtly not aligned, and then these ones are aligned, and these ones are aligned, and these ones are aligned in this position. And then when you go back, we're looking for the same thing. So if I freeze it roughly there, again, these two lines here do not line up, these two lines do not line up, these two lines do not line up, these ones do, and these ones do. Can you see that? Then another thing I also look for to see if the bones are separating in the front more so than in the back, and then depending on what that angle is would delineate how severe the injury to ligaments could be. Okay, so then on round two you can see more definitively here that these two lines don't line up. So this one ends right here. So the one below it should be right here, but it's over here. And the same thing here to a lesser extent. And then here even to a tiny extent as well, but then these ones line up and these ones line up. And then another thing that happens when you go all the way back is that your first bone, it actually tilts sideways. And it shouldn't be tilting sideways when you're going forward and back. It should just be going forward and back. It should have no side sway. And the reason it has side sway is it correlates to what I showed you with the open mouth X-ray, where the shift was happening to the either side. And because the suspicion of those ligaments being injured is there, that explains why this is tilting to the side when you tilt your head back. And you can even see here that that first bone starts to tilt sideways when you really push those movements. And that's it.